Hello and welcome to Advanced Women's Health. I am Dr. Sarah Wilson, a naturopathic doctor, the founder of Advanced Women's Health, and the clinical director as well. So, we are here today to talk about endometriosis. And endometriosis is a condition that is extremely close to my heart because I have endometriosis. And so, from that standpoint, I have spent years digging through the research and really staying abreast of what is happening in the literature in terms of understanding this very unknown condition. And so, what we have come to appreciate is that endometriosis is an inflammatory condition. It's a core issue with the immune system that is then fed forward and made worse by hormones. And so, when we are focused very specifically on hormonal management, whether that is through medications, hysterectomy, a variety of different surgeries, when that is our focus, we are missing a huge component of this condition. And so that is really the core focus my entire team takes at Advanced Women's Health is to dive into those different layers of immune dysfunction to get you feeling more like yourself again. But what is endometriosis, right? Endometriosis is a condition where there are endometrial like cells, not endometrial cells, endometrial like cells that are found throughout the human body. We've seen it in the brain, the diaphragm, right? The lungs. We have seen it throughout your whole abdomen. We have seen it around, most commonly, right? We see it around the ovaries and the uterus. And so this condition can cause significant pain with periods, but not always, right? It can cause pain with bowel movements, pain with intercourse, but not always. And it's really important to understand that, right? It can cause brain fog. It can cause all these indistinct symptoms, right? We have fatigue. We have mood challenges around periods. We have systemic body pain, right? In my situation, I always had menstrual pain, but I didn't know how bad it was, right? It responded to Advil. And so it wasn't until it manifested throughout very significant back pain that it became something that was worth driving forward to get a diagnosis for. But in the process of applying evidence to the treatment of this condition, you're not only helping with period pain and digestion and fertility and pain with intercourse and body pain, but you're really helping to systemically improve your immune function, which is so critical to understand. So, my entire team at Advanced Women's Health is trained on the evidence informed perspective of endometriosis care. Right? We are taking the research and we are applying it to our patients' cases and staying up to date in terms of training. So, what most people don't know is that all of the naturopaths at Advanced Women's Health meet every day for clinical rounds, right? When we say you get collaborative care, we mean you get collaborative care. So that might mean that after a hysterectomy and your hormones are completely bottomed out, you might need the care and focus of someone who focuses on menopause, but also someone who focuses on the immune system and the digestive system. And you get all of those benefits when you're working with someone on our team. So I hope that helps you to understand a little bit more what endometriosis is and what it's not. It's not a hormone condition. It will not be solved or cured by taking a hormonally suppressive medication, by laparoscopy, or by a surgery, right? Like a hysterectomy. It is not cured in any of those situations, but it can be improved and supported when you work in line with evidence-based principles and you support the immune system on whole. So I hope you enjoyed. I can't wait to work with you guys. If you have any questions, feel free to reach out to our team. We can get you set up with a patient onboarding coordinator to help you find the best practitioner, or really just honestly offer you different levels of support because I am so passionate about women finally getting answers, and so many have endometriosis and don't know it. And if you're one of those people or someone who has a diagnosis, we can help.